Hello, everyone. I'm Jada Levine. I'm majoring in biomedical sciences.
And my name is Julianna, and I'm also majoring in biomedical science. And today we're going to be doing our presentation on hemangiomas. We're first going to start off by giving a quick overview of what our presentation is going to be about. First, we're going to describe what a hemangioma is, some of its possible complications, how it develops, also with its symptoms. We have some treatments that are commonly used, as well as an interview with someone that has personally had a hemangioma, and also some images to go along with it. So first we're going to start off by describing what a hemangioma is. It's basically a cluster of blood vessels underneath the skin. It can be deep or superficial. It's considered a benign tumor, and it's most typical in children, especially babies around 2 to 3 weeks is when they most commonly form. And it's also seen in girls more than boys most times. And some possible places for them to appear are on the face, scalp, chest, and the back, but they can occur all over the body, and it does not exclude the internal organs as well. On the right-hand side of the screen over here, we have a couple of images. On the top, it's just showing a cartoon of what the blood vessels look like underneath the skin and how it creates this raised bump that you can see in the picture below on this little girl's head. From there, we're going to talk about how hemangiomas develop and some of the symptoms of them. So the most common hemangiomas happen when a newborn baby is born, and it's within the first couple of months. It usually starts out as a flat red mark on the body, and again, it can be really anywhere all over the body, and most commonly on the skin and not the internal organs. And after that red flat mark has been there for a little bit, it starts to have a bumpy appearance and becomes a little bit more elevated off of the skin. It's also nicknamed a strawberry birthmark because of its red color and its raised bumpiness. Some children will get more than one depending on their birth. And it's also shown that when there's multiple children born at the same time, such as twins or triplets, that they are more common to develop a hemangioma. And on the right-hand side of the screen, you can see the development of a hemangioma being able to heal over time on its own. Typically, it's the worst when it first forms at a younger age, and then as time passes by, around a year, it slowly begins to heal on its own in some cases, but also with other cases, they provide treatments in order to get a better looking appearance. It just depends on the case. As far as diagnosis for the hemangioma, it is commonly just able to be looked at by a doctor, and they're able to just do a physical exam and talk about the parent about the pregnancy and see how it could have developed that way and how it looks to the naked eye, because it is pretty apparent in how it presents. Another way that it can be diagnosed is through an ultrasound. This would be used only if it's a little bit deeper underneath the skin and it's harder to tell, or also if it's on an internal organ where they're having some pain or symptoms that they can't figure out, so then they go in for an ultrasound, or also an MRI can be used on the head or the neck in order to diagnose hemangioma. And on the right, we just have a couple of images of an MRI of a hemangioma, just so that you can see that it goes deeper underneath the skin when you're not able to see on the superficial level.
So for the treatments, when a child is either born with a hemangioma or develops one, it can be cared for by their pediatrician or dermatologist. And in some cases, they may even be cared for by a hematologist or a surgeon, depending on how severe the hemangioma is. Most of them do not even need a treatment and are just monitored by the pediatrician and dermatologist. But when they are more severe, or treatment is recommended because they are causing problems, they are more likely to be treated by a hematologist or a surgeon. So some of the medications that they may use, there's a couple different beta blockers that they use as medications. One of them that causes an infantile sorry, to shrink, and there's one that causes the smaller, less severe ones to be treated through that medication. And then if that does not work, there can be surgical procedures used in order to treat them. So they can be used to repair the damage or different scars caused by the hemangioma. So as you can see here, this is a picture of my cousin, and she had a strawberry hemangioma on her right cheek. She had 5 different laser procedures done to get rid of it, and it still to this day is not completely gone. You can see that it's still kind of faint on her right cheek right there. So some of them are easier to treat than others, and you're able to get rid of them completely, but in some circumstances, you may not be able to.
So as far as some complications go with hemangiomas, these are some things that if a child or a person of any age gets a hemangioma, they can run into some of these issues. So for example, vision, and this is in the case if the hemangioma is on perhaps the eyelid and it blocks the ability to see it all. And then feeding would be if it was in or around the mouth, causing difficulties there. Another one would be for breathing, if it was in the throat or respiratory tract in any way. Diapering, if it was in the diapering area. And then heart failure is if there's an internal hemangioma on the liver, and that's the most common times you'd see heart failure is if they had that on the liver, and then effects on bodily functions as well.
So though they are more common in infants, my mom actually recently found out that she had a hemangioma and had to be treated for it. So I asked her a couple different interview questions just so you guys can get a better understanding of what they are and the complications that come with.
What were your symptoms leading up to the diagnosis? Symptoms leading up to the diagnosis. I actually had gone into surgery for a different problem, and when they went to go intubate me for the surgery, they found a mass in my throat. How did you get diagnosed with hemangioma? Actually, a hemangioma, where they located mine, which was in the area of the epiglottis, is fairly rare for somebody of my age. And so the actual diagnosis wasn't made until the pathology came back after the surgery and after the tumor was removed. What was the treatment provided for your diagnosis? They cut out the hemangioma and then had to cauterize all of the vessels that created the hemangioma.
So as you saw in this case, removal was extremely necessary of the hemangioma due to its location being on the epiglottis. The recovery from the removal was extremely painful, as she had told me. So because it involved cauterizing or burning the tissue in her throat, she said that when swallowing, it felt like 1,000 broiling razor blades in her throat. So it can be extremely painful. And as you can see, there's a lot more severe cases of hemangiomas and some that are not so bad. So next slide. So as you can see in this picture, her hemangioma was extremely large for where it was located. In her throat, it was 1.5 centimeters in diameter. And because it was an incidental finding, she did not experience any of the symptoms. So someone could have something like this and not even know and not show symptoms, which could be very dangerous. So it was very good that they had an incidental finding, even though she was having surgery for some other circumstances. And then here are our references for everything that we talked about today and all of our images.
Thanks for watching.